Hello, and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center, and I'm here with Tiffany Adjei. How are you today?
Hi, how are you?
I am great. And I think our show counter is counting the wrong way, so maybe this won't air, but that's fine. It'll make it more casual for us.
Yes.
I did have a question, because you're so integrated into senior care here in the greater Akron area. I've always wanted someone on the show to talk about this. When we first started Ascend Health Center, we went into all the skilled nursing facilities, and there's just such a great need both for their mental health and their physical health. So my first question is, and then we'll talk more about who you are and what you do,
okay.
But more importantly, what's wrong with elder treatment in the U.S.? Like compared to other places, what do we do wrong?
I think with that being said, I think with it, it's more of, I think we kind of lack empathy for them. I think, with elderly, they usually, when they're home and they don't really have, a lot of people come in the system with specific things. I think instead of looking at them as a job or a number, we just start looking at them as a human and just knowing, these people have taken care of us, throughout our lives. We have to treat them as such.
Right. So it's more of a respect thing where instead of honoring our elderly, it's more like, okay, now you're in this population that's no longer quite as useful. Like I read somewhere one of the unique things about American culture is how once you turn 70, we feel like we're fit to run the government, but nothing else.
Yeah.
We're perfectly fine with presidents and justices and senators being 70, 80, 90, but if you want to do anything else, there's this huge ageism issue.
Yes, for sure.
Okay. Well, why don't you tell us like how you started with healthcare, and because I know you at one point you were trying to be a nurse, and then you realized that no, actually I'm better served to help the elderly population by going a different path. So can you tell us a little bit about that?
Yes, of course. I started off as a candy striper. So my mom, she had me volunteer as a candy striper, and I think once I've gotten that just feeling of experience of helping someone, I just fell in love with it. I'm like, I'm going to go in here and just work with these people, and but then once I got in there, I'm like, I actually like this. I love helping them. And then, just getting older, going into nursing as a registered nurse, I transferred my degree over to Public Health and Health Services Administration because I already was into the home care industry at that time. So.
Okay. And then walk us through what the different stages are, because, again, in this country, now with my Greek heritage, which somehow I bring that up into every single show, it's kind of embarrassing actually, but that's also part of Greek heritage, is talking about being Greek whenever possible. But both of my grandmothers, we took care of them until they died in our home. That's part of the culture of that. You don't send the elderly off into some home and visit them on Easter and Christmas. It's like, nope, they took care of you, now it's your turn to take care of them. Even if every night at 3 a.m. they start screaming about the donkeys and the fields as if they're still in the village yelling from the rooftop so that everyone in the village can hear them. That's just what you do.
Yes.
So what's the appropriate amount of, this is a terrible question, but that's fine. What's the appropriate amount of sacrifice for like, okay, I can help you in my home, or I can do this for you, Mom? And when is it like, okay, I'm going to need some expert help?
Yes. I think, because there's a lot of cultures that do that, they want to keep the parents or their grandparents home with them to take care of them. Like, that's what we're supposed to do. It's like our job in specific cultures. But I think, too, is having the right team on board with you, the right doctors, the nurses, having a good staff and planning for that, I think is really helpful, because you can't do all of that alone. It's very emotionally draining sometimes when you're working, you're taking care of kids, you're busy, and then you have to take care of your loved one as well. So it's like, no, you have to, bring that team on to assist you with your loved one.
So you're saying it's not appropriate to realize, oops, I'm overwhelmed, I can't do this, because a lot of times that moment happens when there's a fall or an incident. You're saying like, well, even if it seems like a little bit much, let's get this whole team together and let's start planning so that way we can slowly introduce, because obviously a lot of seniors also aren't that excited about having somebody help them.
It's true.
They value their independence. No one wants to end up dependent on people for every single daily need.
Yes, it's very true, and I think just having the right people in the guardian's corner to assist them with the different experience and things that they'll be going through, is having specialists come in to help with that. Because sometimes we're not equipped as loving our loved one a specific kind of way. We're just equipped to love them, but we're not. We don't have I would say, the tools that we need to take care of them the proper way.
You're saying it's also a problem of objectivity that sometimes we can't. Yeah, that makes sense.
Yeah. So I just think, just having the right people to come in and to help them, to guide the guardian with specific things so that they can have the right, information that they need to help the loved one at the time.
And the opposite could be a problem too, like being too objective.
Yes.
I mean, being a nurse anesthetist, I've done anesthesia for my brother. I don't think you're supposed to do that.
Yeah.
But I also found, no, I'll treat him like every other patient. But that's not necessarily a skill either, like the ability to be objective when it's your own family members and you're saying, okay, here's the health problem, here's how we have to fix it.
Yes.
It can cause a lot of discord, and it's not a position where you want to put yourself in.
Correct. I definitely agree with that 100%. It's different with your loved one. It's different with your grandmother or your parents. Is just different, because you have a certain kind of love for them, and you want to make sure that that we're doing everything the proper way, but it's also, it's your loved one. So it's like, just get the specialists to do the things that they need to do just to assist them with those specific things. Yeah.
So what kind of specialists are we talking about? Because for one thing, you've mentioned guardianship and a few other terms that not everyone might be familiar with.
Yeah.
So does it start with having power of attorney and deciding who's helping mom and dad figure this out, or what's the first step?
I would definitely say, with the future planning, definitely having a lawyer and things of that such, involved. There's a whole team of it. There's the doctors, there's the lawyers, there's the, like you said, the estate planner. These are the people that can give you the information that you need to help plan with that. The insurance information, the doctors that can help with that. It's just basically the therapy, therapist that has to come into the home. So just having that whole layout of that core team to assist with, okay, mom's going to go into the home, or mom's going to go here. Is she going to a nursing home? Is she going to stay home? And just having those conversations early, on when you're in their 30s and 40s and things of that such. It's very important to start having those planning conversations to find out, okay, because a lot of times we only start planning when it happens,
right.
And it's like we have to start planning before things happen. And I think just, getting that team of nurses and therapists and estate planners and things early on will definitely help with the issues that will come later.
That makes sense. The show that we just did was all about families at holiday gatherings and how do you get along with them. And the message was, you might get triggered. You might have your sympathetic nervous system start getting really anxious as you're trying to deal with family. So what you're saying is, why don't we start this planning before it's an issue, before we're all distraught about mom's failing health.
Yes.
And that way we can do so in a reasonable, drawn-out manner that gets things done, as opposed to, we're also worried since the stroke, and here we are as a family bickering and trying to find a solution. And
Correct.
A lot of, we need to do something,
Yes.
but not really understanding of what the next step is.
Correct. And I think by just, sitting down with the family and starting to have those meetings and those conversations is going to help with that process. It'll lessen the arguments more,
right.
With that being said. So I think just future planning is very important when it comes to the care of, the loved one as well.
Right. But isn't there a danger, and again, this is unfortunately part of my personality, isn't there a danger of too much help? Try not to make this morbid. It's okay, it's community TV.
Yeah.
So when someone dies, usually there's one family member who is the most distraught and the most, let's do everything for mom. She meant so much to us. And then the funeral director might point out, okay, this is a family member we need to talk to.
Yes.
This is the one that's going to get the platinum package.
Yeah.
I mean, that's just the way it is. So,
Yeah.
there'll be one member of the family that's like, you know what? Walmart.com sells caskets. We could really save some money. And then there's somebody else who's like, no, 40 dozen flowers are not enough. We really need 80 dozen. Don't you care about mother and what she meant to us? So how do we take good care of our parents, but at the same time be reasonable about it, where, okay, this is what we need right now, and this is what we can afford, and this is what makes sense? Because unfortunately in this country, most of those discussions don't happen.
No, they don't.
I mean, I have them all the time with patients, and they find it super awkward.
Yeah.
In part because I'm super awkward, but also because healthcare just understood as this thing where, like, it's almost offensive to talk about the financial aspect of it.
It's true.
I mean, that's not true in all cultures. Like, I was just reading how in China now that they have these COVID outbreaks, a lot of the elderly don't want to get treated because they're like, no, I don't want my savings to go to treating me when it's supposed to go to the next generation.
Yeah.
And in our country, we kind of have the opposite feeling, where it's like, hey, let me spend all of my life savings on these last 90 days of my life in the ICU.
Mm-hmm.
So what's a smart way for family to talk about this awkward part of almost end-of-life planning?
Yeah. I think, too, sometimes is having someone come in with the meetings. Mm-hmm. And I would definitely say, it could be like maybe a nurse or, a therapist or someone that can, really sit down with the family, or also the estate planner, someone that's actually, going to plan majority of everything with them to help them make those decisions. Just having someone just be there as a support system as well, because the arguments can start. And also just making sure that there's a will, or, that who is the person that is over everything. Just like you said, sometimes they can be too much or too less, but, just having that specialist come in and just assist them with the planning part of it all. I think they should be, just through the whole planning process of that.
So how does one find one of these estate planners that you're talking about? Oh
yeah, they actually, there's a website, there's a lot of websites as well that if you do have like a family lawyer, sometimes if you don't, there's a couple of websites that you can go to that can assist with finding an estate planner. Okay. Someone that will probably fit within the company. In the family. You do have to do a lot of little research. But ask around, I would ask, do you know a good estate planner? Do you know someone that can, assist with these specific things that we're looking for? I think just opening up and talking to people about that can.
So is it fine if our viewers just ask you?
Oh, yeah, of course.
Great.
If they need to ask
easy for
me,
everybody.
Of course. I do have a lot of resources as well. That can assist with majority of that. I do have, a list of estate planners, a list of lawyers, and a list of doctors that I, communicate with on a regular basis. So if they ever needed to do that, I can assist them with that.
Okay. And since we haven't gotten to this yet in the 13 and a half minutes that we've been on the show, what exactly is that you do now, and how do people reach you?
Yeah, I am the executive director for senior staffing. The company has been around since 2018, and Teresa, she is the owner of the organization. She actually is a ball of sunshine, so that's why it's called Sunshine Staffing. She really cares about the elderly community when it comes to them. She cares about the care of elderly. And I think, with that being said, they can find us at seniorstaffing.com. The phone number is also listed below that can assist with any care needed for the
And I think that's
community.
something that I found remarkable about the elder care community, that if you're searching for help, you don't necessarily need to find the right person right away, that there are a lot of very accommodating organizations where, because I'm sure some of our viewers would be like, I don't need senior staffing, I don't understand what that has to do with my particular issue, but they can still contact you and you can point them at the next step.
Yes, for sure. We can definitely assist them with any information that they may need. I do have have contact lists, any information through the state Alzheimer's Association.
Sure.
I'm also accommodated with as well. So, if they need any assistance, I can definitely assist them with that.
Now, is there anything that they should avoid? I mean, this might be a more personal question for you, but there's so many little niches in elder care, and I'm sure some of them are a dumb idea. Is there any in particular that, like, let's say, oh, assisted living is really expensive in this particular case, or this one's too much, or this really isn't doing? Because, I mean, again, I've been a nurse since 2004, so I know all the stories where the state comes to inspect the nursing home, and all of a sudden, everybody's brother who's an employee shows up to show the state, like, oh yeah, we've got tons of employees. And then as soon as the state leaves, it's one LPN passing meds to 60 patients, and you know they're not getting anywhere near the care that they need.
It's the truth. I think just having, you know, making sure that there is enough staff, but also trying to find that quality staff sometimes can be very hard as well. You know, the processes that we go through when we are bringing our clients, bringing our nursing assistants on, they go through like 3 different interviews, you know, and it's like with it's almost like a matchmaking service, you know, just trying to find that perfect, you know, quality aid that can assist with, you know, with the client's care. Sometimes that can be really tough to do, you know, but just making sure that, you know, you're matching the nursing assistant up with the client, making sure their personalities and things match, you know, as well is very important. But I would definitely say, because I have assisted living friends that are directors.
Come on, just tell us what's.
I don't want to, you know, I don't want to, but I can say that assisted living is a little more expensive than home care.
Okay.
You know, because they do have to, you know, there's activities, they may sometimes go on different trips and things, you know, that they have to pay for their meals. And so there's a lot of different things that's included with that. But, you know, if a client is home, you know, the aide prepares their food, the food is already in the home. So you do save a lot of costs, you know, working, just them living in the home, and nobody wants to really leave their home, you know. So it's just, we try to keep them in their home as much as we can, and just bring them that, you know, that trust and safety to the home, so they can feel comfortable as well with, you know, a stranger being inside of the home.
So what you're saying though is that if a viewer thinks that their parents need to be going to a nursing home or a skilled nursing facility or even assisted living, it sounds like it's not that much different from selecting a college. Like, oh, this one has a rock wall and they have a buffet. Oh wait, look at the tuition. Like, you have to really think, is this a need to have or a nice to have?
Yeah.
You know, because a lot of times it's just guilt based, where, you know, I haven't really seen mom and dad a lot in the last few years, so let me get them a really nice nursing home.
Yeah.
And that's irrelevant to what they really need.
Yeah.
Okay.
It's the truth. I agree. Sometimes I think going off of the need of the client is very important. You know, just really paying attention to, okay, where would mom be comfortable, or where would dad be comfortable? Where do we, you know, and also asking them where would they want to go sometimes. You know, we don't actually ask them, talk to them and speak to them. Okay, mom, where would you want to go, or where would you like to go? You know, how are you, where are you feeling? Of course they're going to stay home, you know, but sometimes it is, you know, you have to make the best decisions for the client, and I understand that sometimes they can't keep them home, but you know, just adopting that system is just, you know, that core team system is just very important to start off with.
And again, specifically what you do now is it's home health with nurses' aides. So if someone can no longer be by themselves 24 hours a day, if they need help bathing and washing, that's the sort of care that you're talking about.
Yes, is someone being there, you know, with them majority of the time to assist them with their, you know, the shopping, the errands, the bathing, the, you know, also the medication reminders. You know, where we have now where the nurses will be doing the medication reminders, the LPNs, if they need their medicine, we can have a nurse come to the home and actually, you know, provide them with that service. If they, you know, also if we need any anesthesia or anything, and I wouldn't say anesthesia, but any pain management, we can call you, Nick.
That you can.
So, you know, and moving towards more into the telehealth as well is kind of important, you know, instead of them going out into, the doctor's office in the wintertime. They can do that online, which also makes it more easier. So just trying to also, make it convenient for them is, I think, what, we're really trying to do.
And there's different options where you can have somebody come in once a day just to check on you, or somebody who's there for hours every single day. That's what you're talking about?
Yes.
And again, the whole goal here is to keep them in the home.
Correct.
At what point is home health care not an option anymore? How sick does someone have to be?
Now, I would definitely say if they're close to, basically the end of life, if it's, has something to do with them basically just, hospice, I would say. They do have hospice nurses that comes into the home for that. But, if it gets too bad, I would say that probably would be like the worst case scenario where they would have to go to, a hospital or to just stay in a nursing home if, they can't really do too much with, they can still stay home with a broken leg and things of that such. But I would definitely say if it was close to just the end of life,
that makes sense.
Yeah.
Because that is another awkward thing about our healthcare system here in America, is that poll after poll shows that nobody wants to die in a hospital.
Yeah.
And the reality is that almost everybody dies in a hospital.
Yeah.
So finding that balance of like, okay, here's the care that you need, and the realization of like, well, what's the end game here? Like, what will we be able to do by moving you out of your home?
Yeah.
Is it just, okay, you may live a few weeks longer, but then you have that separation from your house, from your friends, from your family. And that's where, which was probably originally going to be the purpose of this show, but this is all really important information.
Yeah.
The mental health of seniors is obviously a passion of mine.
Me too.
And we see that all the time at Ascent Health Center, where they'll tell their kids one thing, and then when they come in to see our psychologist or a psychiatrist, it's a different story. So what's the best way to help the mental health of seniors? Like, what have you seen in your work with them?
Oh, yeah. I've actually, I've had a client as well, because I also serve clients myself, because I have, like, I'll meet the client first, and then they fall in love with me, and I have to care for them myself. So it's like, I go back into the nursing role as well from time to time. But I have this client of mine during, COVID. There was a lot of isolation and loneliness for the elderly community, and during that time, we did like grocery shopping for them, dropping their groceries off for them during that time. What I did personally is, with a lot of the clients, I actually delivered cars and flowers to their houses. And the family that, that I spoke with, they always used to like really thank me for that, because I think during that time, with the mental health, it was really bad for them. They were alone. A lot of people couldn't go see them. Their families couldn't see them. Even inside of the nursing homes, you couldn't see your family members. So just the loneliness and the isolation that they had at the time was just very, I was saddened by it. So I'm like, well, what could I do,
Right.
And so I would just personally write them cards to let them know, I'm here, we're here, write us a letter, do video chat,
Right.
things of that such, just to get them to understand, they do have someone here and you're not alone. So I think just trying to, just be there for them and not
Right.
just leave them alone and not think about them. I think we need to start being more, empathetic when it comes to things of that such, when it comes to the elderly community.
So you're also saying, if someone's like, well, my father is getting sicker, I don't know what to do, I don't have a healthcare background myself, I can't really take care of him, well, the least you can do is visit him. The least you can
Yes.
do is be there, strengthen the relationship.
Very much.
Because in our practice, what we see a lot is this diagnostic differential of, is this dementia or is this depression? And a lot of times it's interwoven in such a complex way that, no, what they really need is a strong relationship with
Yes.
those who are important to them.
I agree.
We've seen almost miracles where it was thought, okay, this is end-stage dementia. And I was like, nope, they need to talk to a therapist, work through some things, even at their age. Because you're right, these are the generations where if they're suffering with physical pain or emotional pain, they're not going to go make a TikTok about it.
Yeah,
You're
like,
not gonna know.
we go to social media, Facebook and things of that such. They, when it comes to technology, they're not too good with that. So, it's just, just making sure that we're giving them that contact. And they love when you come to see them. You know, it really helps them with their mental health. Is just, you know, and dogs as well. They love dogs. Dogs can always make you, you know, even us as people, we love dogs, you know, and elderly community loves animals. They love people to come in and just see them and just to know that they're here, they're alive, they're, you know, still thriving and moving. And, you know, I think just us, you know, tapping into that with them has really helped them out mentally.
Right. And I think that's a better way to approach it too, because, you know, we do some cases where we'll do tests to see what kind of cognitive impairment is going on. And a lot of times that's hard for the elderly too. Like, you know, what are you trying to figure out? Why am I here? But a lot of times that's what I'll tell family members, like, well, why don't you have your mother come and talk to one of our therapists or see our psychiatrist? And it's not to establish a patient who will have to see us over and over again. It is just a healthy checkup to see where are we, what might we want to do in the future. Let's get a baseline before the health deteriorates, so we can sort of see, okay, here's a path, whether it's for pain management with the ketamine infusions or some of the other interventions. Because I think that's really important for the elderly too.
Very important.
They have so many medical interventions where it's like, all right, here's this pill, take it till the day you die. So I think we need to, in this country, we need to be conscious of what interventions can we do that are still limited, that are still, here's what we need to do for today or for the next few weeks. And then we can lay off of this and continue to focus on the quality of life instead of just necessarily the numbers of days that you have left.
Yes, I definitely agree with that. And just taking them out from time to time, you know, like sometimes I guess with people, we think just because they're in nursing homes or they're in the house that they can't move or get up and go. We can take them to lunch, you know, you're allowed to take them places and, you know, take them to like their favorite, just, you know, specific things. Like I used to have a client that used to love baseball and he loved baseball so much. And I'm like, when was the last time you've been to a game? Like he could walk in everything, you know? And so what I did was I set him up with, you know, one of his, I think it was his brother or his nephew. It was his nephew, I'm sorry. And his nephew, I talked to his nephew. I said, why don't you take your you know, your uncle to a game with you one day? And he, you know, just a suggestion, you know, I'm like, he can still walk and move around. He can do these things. And I spoke with him. He got them some tickets to go see the Indians, and it was just awesome. You know, because I wanted to talk to him and converse with him. I'm like, so how was the game? He said, Tiffany, it was, and it was just the liveliness and him lighting up and just talking about those things. So it's like that helps with mental health as well. It's just doing things with them, you know, taking them places. They're not glued to the couch. They're not glued to those things. So I think just, you know, keeping them active as well, if they can be, is very, very, you know, relevant to them as well.
Well, that's all the time we have for today, but thanks for coming on the show, Tiffany.
Thank you very much for having me.
Absolutely.
You are watching WCTV, Wadsworth Community Television.